This is a video explaining the new paediatric short Pews charts which are being introduced into UHD across both RBH and pool sites. These charts are categorised into 4 different age groups: 0 to 11 months, 1 to 4 years, 5 to 12 years and 13 years plus. Let's have a look at a patient aged between 0 to 11 months. So our patient is 10 months old. We're going to have a look at how we plot their observations onto the chart. So these charts are used to help us identify when our patient is deteriorating and how sick that they are. So firstly, let's have a look at plotting the temperature. So we're going to work from the top down. So plotting the temperature, our patient has got a temperature of 37.5. As you can see, there is no coloured zones in the temperature box. This indicates that there is no scoring criteria. So our temperature is 37.5. So we're going to plot it midway between the 37 and the 38. Although there is a red line there indicating 38, that's kind of indicating what we would class as a high temperature for this age group. So it's something to be in mind of, but doesn't actually score anything. So as we move on to our heart rate box, we have a heart rate of 150. So as you can see in these boxes, as I've previously said, the coloured boxes indicates a certain score. So our patient is scoring 150, which is actually borderline between the white box and the yellow box. So we always say to go up. If you are borderline, you'll always move to the next box. So this means that this will score us 1 for our patient. Moving down, we'll go down to the blood pressure box. This is an observation of 92/58. So again, we will plot that in the yellow box, which will score another 1. We only score for systolic blood pressure. The diastolic doesn't count. So again, that's currently a score of 2 so far. Then we move on to our capillary refill time. The maximum you can score in this area is a 2. Our patient has a cap refill of less than 2, so they don't score for that. Moving down to our respiratory rate, our patient has a respiratory rate of 68. So if we look into our box again, we're going to plot it just below the line of 70, but that is in the yellow box. That's not borderline, that is yellow. So that's another score of 1. So let's move on to our work of breathing box. That's categorised as nothing, as mild, moderate or severe. So our patient has a tracheal tug and recession. And from my nursing intuition and observation, I would class that as being moderate. That's going to score us a 2. Next, we move on to oxygen saturations. They are currently sat at 91%. So if we look at our box, that will actually score us a 4 because it's 91% or less. So we are in the red zone for that area. If we move on to the next box of oxygen required, they're actually having 2 litres of oxygen at the moment, which is in the orange box, which scores us a 2. So let's go back through our chart and add up our score. So let's start at temperature. That doesn't count. Moving on to heart rate, that has scored us a 1. Blood pressure, our systolic, has scored us a 1. Cat refill was less than 2, so that's a 0. Respiratory rate was 68, which scored us a 1. Work of breathing we felt was moderate, so that is a 2. Our saturations were sat at 91, so that scored us a 4. And our patient was in 2 litres of oxygen, which puts us in the orange box, which means we've scored a 2. So this gives us an overall Pews score of 11, which we're going to document in that yellow box at the bottom. We're then going to initial it so that we know who's carried out the observations. Let's then move on to our pain score and blood sugar box. They are both in blue, which indicates that they don't score, but it's important to document our values in there if it's essential for our patient. After that, and below that, we move on to trigger criteria. This is an area which we use to highlight where we may have concerns regarding our patients. And on the back of our charts, as you can see, there is our escalation level. So we have just scored our patient as an 11, which if you go along your Pews score and go along to 11, it indicates that it's high. So So this means that we're going to look down those boxes and is there a suspicion of sepsis? Have we had a change to our altered state? We've got clinical concerns that our patient needs a rapid review. And where our trigger criteria hits will then move us down to our escalation level to identify what we need to do. So in our case, it would be an immediate review by a nurse in charge. We'd call the paediatric code blue if we're in ED, and we'd want an immediate medical review by our senior doctors. So it's a way of guiding us through to the right escalation that our patient needs in that moment in time. And as their Pews score changes, so does our escalation. So what these boxes are also for us to highlight is that we do have patients which may only score very low on our Pews charts, may only score a 1 or a 2. However, if we look along our trigger criteria, if we've got concerns that there's been a change to their altered state, for example, so actually they're only responding to our voice, then our Pews score of 1 gets overridden by our trigger criteria, and as you can see, the green box would push us along to our high escalation. So it's a way of just helping us to identify that the Pews score is very important, but our trigger criteria will override anything that our patient scores to help us identify that they are extremely sick and need immediate help. So just to summarise, you use your Pews score to identify your initial escalation level. Just to summarise, use your Pews score to identify your initial escalation level. Look at your 4 trigger criteria: sepsis, AVPU, family concern, nurse intuition. The trigger criteria will also indicate an escalation level. Respond to the highest escalation level triggered either by Pews or trigger criteria. Response to escalation level is documented below. You do not score for pain, AVPU or trigger criteria, you just jump to the relevant escalation level. If you need any further help or support with any of this to do with the Pews charts, then please contact your local Peds education teams at both Bournemouth and Poole sites.